Another exciting area in orthopedics is biologics or regenerative medicine. So a lot of orthopedics, and the stereotype is we use hammers and saws and are very mechanical solutions to oftentimes biologic problems. So just because you tear something, it's not always just the mechanical forces that tore it apart. That's the problem. Oftentimes there's perhaps the cells in our body are getting weaker or less healthy over time, and that eventually leads to a weakening that then leads to a tear over time. And so longer-term solutions probably combine mechanical solutions like sutures and plates and screws and those kind of things with biologic solutions. So taking the layman's term of stem cells, for example, or different chemicals from our bloodstream and try and use those to help stimulate healing. So people might have, like, for example, chronic tendinitis that just doesn't respond to the usual icing, Aleve, Motrin, Advil, those kind of medications, perhaps physical therapy. And we need to inject some kind of biologic answer to try and get their tendon to heal better. So we've got some different options, and the most popular ones someone may hear about would be platelet-rich plasma, or PRP, which sounds really crazy, but it's not. What it refers to is taking a patient's own blood, spinning it in a centrifuge machine, and then just taking out the parts that are helpful for healing and leaving the other parts that aren't helpful for healing to the side. And so what's nice about it is it's the patient's own blood, so it's very safe. We're talking very small amounts. It's very safe. There's like no risk of rejection or no risk of having an allergy, so those kind of things are safe. And then the idea is to try and concentrate the healing factors that's in someone's blood that can then sort of like super target an area that has an injury or requires biologic stimulation to heal. The other popular one is using patients' bone marrow. So it's a little bit more invasive, but not much. And you can, sounds a little scary, but you can use large needles and withdraw just a little bit of bone marrow from a patient's hip. The hip is a part of the body that has a lot of healing cells and stem cells, probably the best part of the body. And so we've been using these cells for years and getting patients' spines to fuse and getting fractures that are hard to heal to fuse. But we're now just starting to use these same cells in lesser amounts, again, in those tendinopathies and certain arthritis situations where we want a biologic solution to try and decrease the risk of a larger surgery, or at least decrease the amount of mechanical treatment that we have to provide somebody.